Your dentist recommended a crown. Here's what you need to know. When is a crown necessary? A crown is typically recommended when a tooth has seen better days. Crowns correct teeth which are cracked, broken, or worn down. Dentists may use crowns to repair cavities that are too large for fillings. What is the main benefit? Crowns restore the strength, function, and appearance of a damaged or weakened tooth. This prevents further damage and deterioration. What is the procedure? Your dentist may recommend a same-day crown, which uses a digital 3D camera to make an impression of the tooth, in order to make the crown on-site in just one visit. Alternatively, a traditional crown procedure takes 2 visits. Your dentist preps the tooth, filling the top and sides, and then makes an impression. This impression goes to a dental lab to make your crown, which takes about 2 weeks. Meanwhile, we protect your prepared tooth with a temporary crown. At your second appointment, your dentist removes the temporary crown and cements the permanent crown to your tooth. More questions about crowns? Just ask. We're always happy to take the mystery out of the mouth. Book an appointment today.